This is my student support system. Keep watching, keep learning.
Good morning. Welcome to my student support system. In today's class, we will discuss about growth and development in children. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture, or you can directly visit to channel my student support system. Let us see what is growth and development. The term growth and development are often used together, but they are not interchangeable because they represent two different aspects of change, that are quality and quantity. Let us see in detail. First, we will discuss about growth. What is growth? The growth is defined as net increase in the size or mass of the tissue. It is mainly related to the multiplication of cells and increase in the intracellular substance. In other words, we can say that increasing the size and weight of the child is considered as growth. Then we come to development. Development is defined as maturation of functions or skill. It is related to maturation of the nervous system and indicates acquisition of variety of skills for the best possible functioning of body, such as that walking and learning new skills, speaking, learning words, language, etc. Factors affecting growth and development. This is very important question which is asked in examinations of child health nursing. That what are the factors affecting growth and development? Both growth and development are closely related. Hence, the factors which affect one aspect means growth, they also affect development. So we study the factors affecting growth and development together. There are a lot of factors which affect growth and development of children, and now we will discuss them one by one. First is genetic factors. Parental traits are usually transmitted to their children. All we know. Thus, sometimes tall parents have tall children, and the size of head is more closely related to the parents than the size and shape of the hands and feet. Chromosomal disorders and mutations in the specific gene can also affect growth. Chromosomal defects like Turner syndrome and Down syndrome manifest as growth retardation. Genetic factor also affects development process. Intelligence of parents has direct correlation on the final IQ of the child. Moreover, certain developmental patterns are observed to follow parental patterns like speech. Then another factor which is very important, that is hormonal factors. Human fetus secretes thyroxine from the 12th week of the gestation. Thyroxine and insulin have an important role in the regulation of tissue excretion and differentiation in the fetus. Both hormones are required for normal growth and development of the fetus. Glucocorticoids also play an important role, primarily towards end of the pregnancy or gestation, and influence the prepartum maturation of the organs such as liver, lungs, and gastrointestinal tract. Then sex of the fetus. The pubertal growth spurt occur earlier in the girls, but the mean height and weight in the girls are usually less than the boys of their corresponding age at the time of full maturity. Nutrition. This is also very important factor. Nutrition is a very important factor that affects the growth and development of the child. Growth of the children suffering from protein energy malnutrition, anemia, and vitamin deficiency states is retarded. Calcium, iron, zinc, iodine, and vitamin A and D are closely related to the disorders of growth and development, and their deficiency is associated with the adverse health events in the childhood. Then maternal factors. Mother's own health, her fetal and childhood growth, and her nutrition intake and body composition at the time of pregnancy and during the pregnancy play an important role in the determining the fetal size means growth. Teenage pregnancy, advanced pregnancy, recent pregnancy, high parity, and some disorders like anemia during the pregnancy in the mother negatively influence the fetal size and health means growth. Then infections. One of the commonest contributor to the poor childhood growth are infections. Persistent or recurrent diarrhea and respiratory tract infections are common cause of growth impairment. This all parents should know that if the infection is persistent, then their height or weight may be less. So they should point out this and get the child treated. Chemical agents. Some medicines such as androgenic hormones initially accelerate the skeletal growth. However, androgens causes the epiphysis of the bone, means ends of the bone, to close prematurely, leading to the early cessation of bone growth, means height is stopped. Socioeconomic factors are also there. Children from families with high socioeconomic status usually have better nutritional state. They suffer from the fewer infections because of better nutrition and hygienic living condition, and their growth will be better. But in case of poor socioeconomic condition, it leads to the hunger, undernutrition, and increased episodes of infections, which may cause poor growth and development in the children. Environmental factors. The process of growth may alter in the different seasons and is usually higher in the spring and low in the summer months. Infections and infestations are common in the hot and humid climate, which ultimately also affects the growth and development. Weather also have a vital role in the agricultural productivity. Readily available foods and capacity of farmers to produce healthy and good food grain, vegetables, fruits to be available for the populations. So it also affects the growth and development of the children in the community. Then emotional factors. Children from broken homes and orphanage do not grow and develop at an optimal rate. Anxiety, insecurity, and lack of emotional support and love from the family reduce the neurochemical regulation of growth hormone release. Cultural factors. The methods of child rearing and infant feeding in the community are determined by the cultural habits and conventions. There may be religious food taboos that affect the nutritional state of the child and which ultimately affect the growth performance of the children. Then educational factors. Mothers with more education are more likely to adopt the appropriate health promoting behaviors which have direct effect or indirect influence on growth and development of the child. Now we come to the periods of growth. This question also comes in the examination as a short note and small answer questions. That which period belongs to which age? First we come to the prenatal period. Ovum 0 to 14 days of gestation. Embryo 14 days to 9 weeks. Fetus 9 weeks till birth. And perinatal period is 22 weeks to 7 days after birth. Then we come to postnatal period. Newborn or neonate is first 4 weeks after birth. Infancy is 1 year up to 1 year. Toddler is 1 to 3 years. Preschool child 3 to 6 years. and school age child 6 to 12 years. Adolescent period. Early adolescent period is considered as 12 to 13 years. Middle adolescent period is 14 to 16 years, and late adolescent period is 70 years. Thank you students for watching this video. You can subscribe the channel for latest updates and you can like Facebook page, and for making your notes you can visit mynursingstudents.blogspot.com. You can follow me on Twitter, Instagram and join Facebook group Nursing